Welcome to Life in Sirens, Behind and on the Scene, a podcast by first responders. We're your hosts, Sophie,
Jamie,
and Aubrey.
The content provided in this podcast is for informational and educational purposes only and should not be considered medical advice. The views and opinions expressed by the hosts and guests are their own and do not necessarily reflect the official policies or positions of any medical institutions, emergency medical services, or healthcare organizations. Patient privacy is a top priority, and all discussions involving real-world emergency situations are de-identified and altered to ensure confidentiality. Always consult with a qualified healthcare professional or your local EMS protocols before making any decisions regarding patient care or medical practices. Listener discretion is advised, as some topics may include discussions of real-world emergency situations.
Welcome to another episode of Life in Sirens. Today we are going to be talking about some pediatric overdoses, which kind of goes along with our last episode, our spooky episode, because this is a subject that nobody really wants to talk about. And with that, James, talk about it.
Yeah. So we're going to be doing pediatric overdoses because it happens. Kids put everything in their mouth. And so it doesn't necessarily mean that anyone really did anything wrong. Kids just put a lot of things in their mouth. And so what are those things?
Well, just about everything. Medications, household products, toxins and plants. It's Aubrey's specialty. Batteries. The button batteries is a big one right now. Tide Pods, that's a big one. We could go on.
Absolutely.
Where should we start?
Let's start with meds.
All
what are
right.
some of the most common meds that kids will ingest?
Definitely just those over-the-counter meds. Easy to get into. We can think like Tylenol, iron,
Ibuprofen.
Motrin, yeah, Benadryl.
Yep. So on those like over-the-counter meds, what are some things that you will see? Or not even necessarily signs and symptoms, but what are some like long-term problems these kids are going to have?
I think one of the biggest ones that makes me really nervous as a provider is the Tylenol or the acetaminophen overdose. Can cause some significant and even irreversible or fatal liver damage. So we hate to see that, and we need to know about it as soon as possible. So that one I think probably makes me more nervous than some of the other over-the-counter ones.
Absolutely. And the Tylenol and ibuprofen, a lot of times it comes in a liquid form and it's flavored and kids like it. So when they do get a hold of it, it's not like they're taking a bottle of ibuprofen. Most time it's in the liquid form, so they'll drink all of it.
Which, side note, at what age do you decide that your medicine gets to taste awful?
I think you're right.
I've never understood that. Why does adult medicine
Money.
taste terrible?
But and also
Follow the money, people.
a big one is now that grade school age dose that's in the tablet, and it's just like a chewable tablet. And if you look in these containers, they're very easy to open. And it just looks like candy.
And some of them will look like vitamins. Like we all remember the Flintstones.
Oh, absolutely.
Delicious.
The iron Flintstones, speaking of iron, very, very toxic to about every organ. Kids who get into iron often need plasmapheresis and some other extreme, if it's an extreme overdose. So it's an intense thing. Don't take that too lightly.
And remember that with iron, a lot of times it's just in a supplement bottle. So it's not childproof. It's just like a pop lid. So be very careful where you store it.
Is that why we see so many overdoses in kids? Like iron overdoses?
I'd imagine, because it's easier to access.
Oh, yeah, anybody can open that thing. A dog could open that thing.
So what about Benadryl?
Benadryl is scary. That cholinergic symptom cascade. I think we see Benadryl overdoses a lot in kids, unintentional by the child's part, but some poor caretakers. So
Absolutely.
we see that often, daycares,
Because they want that kid to sleep.
babysitters.
So when you have a Benadryl overdose, because we do see it pretty frequently, what are some concerns that you have?
So with Benadryl overdoses, you can see significant CNS depression. In other words, you'll see drowsiness, hallucinations, seizures, and sometimes some arrhythmias as well.
What's some treatment for Benadryl overdoses? So
So, like we said, some of the symptoms you're going to see in severe toxicity are seizures and coma, and then respiratory failure, the cardiac dysrhythmias. Specifically, we see VTAC in Benadryl overdoses. So, obviously, supportive care for these symptoms. So, seizures, treat with benzos, your cardiac dysrhythmias, PALS. And then, in some situations, we don't do this in our state or at our service, but activated charcoal is given if it is in a short window within 2 hours of the ingestion. And then most of the time, these patients with severe Benadryl toxicity are going to be admitted to the ICU. Things to look out for are psychosis, so they may have to treat the psychosis, and agitation with also benzos, and then fluid resuscitation. What does Chad always say?
The solution to pollution is dilution.
What a shout out to our dear friend, and honestly, we're his biggest fan, Chatty Daddy. Thank you.
Chatty Daddy.
Awesome critical care paramedic and nurse now.
Yes, he's both. So moving out of over-the-counter meds, but into some prescription meds, we've got opioids, benzos, and clonidine. So opioids, we're all pretty direct on how to treat an opioid overdose. It is still Narcan, even with the kiddos. Be aware that small amounts can cause respiratory depression in kids. So even if mom's like, I don't know if they took it, but I'm missing 2 pills or whatever it is, that's enough to overdose a kiddo. And when you start to look at benzos, similar. What is the reversal agent for a benzodiazepine overdose?
Flunarizumab, but we don't like her.
We don't like her. We also don't carry her.
She can't sit with us.
She can't sit with us. Most of the time for benzo overdoses, it's going to be supportive care. And you kind of let them metabolize through it. But it can cause sedation, respiratory depression, and coma. So most of the time you treat with supportive care. So whether that's blood pressure support, cardiac arrhythmia support, respiratory support.
Pals.
Yep. And then our last one is very common in a lot of households because it's used a lot to treat high blood pressure, ADHD, anxiety, is clonidine. So clonidine can cause sedation, bradycardia, hypotension, and respiratory depression.
It's a bad combination.
Even at really low doses. In kids, it's a tiny little white pill, and kids get really curious. So even with kids, clonidine overdose, it's 0.1 milligrams per kilogram. So it stays right there with a max 2 milligrams per dose. You start with lower doses because kids, but don't be surprised if you don't get a response, and you continue administering until you reach a cumulative dose of 10 milligrams.
Okay. So still, yeah,
Significant.
Yeah, it says in some cases larger doses may still be required, but they need to be carefully monitored at that point. Most time they'll be in a pediatric facility then. Okay, so that's a lot of the meds that you run into with kids and overdoses. Clearly there's a lot that can be gotten to, but the takeaway from that is if you have any kids that will be in your house or live in your house, any medication that you take, keep up and locked away because they're crafty.
They are.
And then get into some things. So moving on, we're going to talk about some household products. So Soph, take it away.
Well, let's start with things like bleach or anything that's otherwise caustic. Things that can burn the airway and esophagus and generally the GI tract. So bleach, drain cleaner, things like that. You don't actually see these as much because they are more rare because these things taste disgusting.
And they're stinky.
They are gross and they are typically difficult to get into. I know that we've talked when we were preparing for this episode how a lot of the times these injuries or illnesses from these caustic substances often comes from kids making a little potion, mixing some things together, trying to have fun. So it's more like a burn type situation externally, or some inhalation. But let's talk about ingestion specifically. According to the American Academy of Pediatrics guidelines on toxicology, which is interesting to me, because we would not typically do this. Of course, we are contacting poison control in these situations, and they're your medical command. So, like, if they tell you to do this, I suppose we will do this. But administer milk to dilute and then transport to the hospital according to the AAP, which is interesting and very simple. Another one we could talk about for household items, staying with the bleach, the laundry theme, is laundry pods. We know
Tide Pods.
Yes, we know the Tide Pods were a big thing. We really are just going to provide supportive care. The AAP also says make sure we're not inducing vomiting. That's not something we do anymore. And be on the lookout for any respiratory issues just as a result of specifically aspiration. So GI upset is really the biggest one there. Obviously, we can have a lot of those, but not as toxic as some of the previously mentioned ones. What else you got?
So another one is antifreeze, ethylene glycol, and you end up with kids ingesting antifreeze because it's sweet. So you see it a lot in pets, a lot in kids, but it's very toxic. It can cause kidney failures, seizures, and death if ingested. A lot of times your symptoms can be delayed. So the problem with kids is that they'll get into something while mom and dad are cooking dinner. They don't tell mom and dad. They go to bed, wake up in the morning, and these symptoms are they're really far behind the 8 ball with these symptoms. So a lot of times the treatment ends up being dialysis and supportive care in that regard. If you have kids or pets and you have antifreeze in your home, keep it very high and very out of the way. Make sure that they can't get into it because it is sweet. So unlike bleach and some of the other things we talked about, they won't stop drinking it. The things that are also commonly in your house that you find are batteries. Find that kids generally steer away from AA, AAA.
Big boys?
Yeah, they're like, that doesn't look fun. However, button batteries, they do look fun. So why is that a problem?
Well, they are pretty caustic. Surprise, surprise. I'm sure we've all seen this on social media or in some other context because it is pretty common. There's some button battery producers who are creating button batteries that taste bad. They have a sour, nasty taste on them. So we know this is a problem. It happens all too frequently. According to the Nelson textbook of pediatrics, we are going to immediately transport. This is pretty dangerous for the GI system, especially if we don't necessarily know how long this child has ingested this battery. They're going to do imaging, and they'll probably have to do an endoscopy to remove the button battery. I know that a lot of the times you'll see to provide the child honey, because this is in case some of the acids that are in the battery, it can delay kind of the effects, but obviously that is I don't know that that's necessarily medical advice, but that is something that you can see, and there's some experiments done that on social media of this honey actually creating significant delay in the battery's erosion.
That's really interesting.
So.
We actually did an experiment with that in school. Shout out to Alex Whitley. And it was really cool to see how much it actually does slow down the corrosion.
Well, that's very interesting. Parents, take note. Providers, follow your local protocols.
Call poison control. I'm sure they'll provide you with the
Absolutely
safest treatment.
So most of all the things that we've already talked about are things that you are generally not supposed to ingest at baseline. But one thing that you are supposed to ingest, well, actually you're not supposed to, but people do ingest, is alcohol. And whether that's alcoholic beverages, mouthwash, or hand sanitizers. What happens when kids get it?
Hand sanitizer is a big one.
Mm-hmm.
So actually, consumption of alcohol in pediatrics can induce hypoglycemia, which is something I did not know until we were researching for this episode. It can also cause, obviously, vomiting, confusion, and even some respiratory depression in severe cases.
Absolutely. So if you get a kid that mom is like, he got into my wine, or, oh gosh, like whipped cream vodka, who knows?
You know those moonshine cherries.
Yeah. I don't know what this woman's drinking habits are, however. But kid gets into some alcohol and parents are concerned. Those are the things you need to pay attention to, is it has a tendency to cause hypoglycemia in kids. And and can cause like coma and respiratory depression. Think about like the drunkest college roommate you ever had. That's what it's going to do to the kiddos. So you need to monitor all of those things, monitor blood sugar pretty frequently.
And one thing to look out for, you might see maybe more commonly or just as commonly as alcohol ingestion in kids is hand sanitizer ingestion, which hand sanitizer concentration of ethanol can be between 60 and 70%.
Oof.
Yes.
60 proof.
Yes, and some products with the isopropyl alcohol can have concentrations of higher than 70%. So they don't have to get a lot of that.
No.
So, and some of these smell very good and look a little bit like candy. You know, the ones with the little beads in them?
Oh, yeah.
So that's one to think about.
For sure. This one is kind of weird as far as things that kids ingest. It's not strange that they would ingest it. It is strange just because I've never encountered it. Another thing that kids will ingest is actually essential oils.
This is interesting.
I just never really thought that this would be something that's toxic. However, a lot of them are. Tea tree oil is highly toxic, and a lot of people keep it in their house because it is like an antibacterial. It's marketed as an antimicrobial. It can help clear acne, lots of things. But if you ingest it, even in small amounts, it can cause drowsiness, confusion, loss of coordination, and in severe cases, coma. It can cause nausea, vomiting, abdominal pain, confusion, ataxia, and respiratory depression. Some other oils that cause problems is eucalyptus. It can cause CNS depression. Wintergreen oil, it has a high content of methyl salicylate, which is similar to aspirin. And so it leads to salicylate poisoning if it's ingested.
Clove oil as well.
Oh. Peppermint oil, which is pretty common because it is pepperminty. And that can cause a lot of cramping, breathing difficulties, and can even cause seizures. And actually your least toxic oil, but still toxic, is lavender. It has more mild, it can cause headache, drowsiness, things like that.
Another one is cinnamon oil.
Cinnamon oil?
Doesn't that sound delicious? But
It does.
obviously it can cause significant irritation to your membranes. And then mouth and throat burns. So can peppermint oil, and it can also cause even systemic effects like liver damage.
Dang.
And those smell great. So.
They do.
So much
as
for
far-
holistic healing.
Oh, yeah,
Good.
holistic hospitalization. So as far as treatment for essential oil poisoning, each oil is a little bit different, but do not induce vomiting. With all of these things, do not induce vomiting. It just basically causes the irritating substance to go right back through the same route, but now it's mixed with stomach acid, so no bueno.
Absolutely.
Dilution. For small accidental ingestions, give a small amount of milk or water, and it can help reduce the irritation. Only ever give anything by mouth if they're fully alert and can swallow safely, can follow commands. So age is a factor here. In hospital settings or in regions, they still do activated charcoal. And as far as symptoms management, that's what you're going to do. You're going to manage symptoms. So IV fluid can help with hydration and blood pressure support. Anticonvulsants. A lot of things in kids just cause seizures. If it's not supposed to be there, that kid's going to have a seizure. So just be prepared. Respiratory support, oxygen per usual, but also mechanical ventilation in the event that you have some respiratory depression. Monitoring. They need to be transported to a hospital. And so in the event of the wintergreen, salicylate poisoning is similar to what happens when you ingest overdose on aspirin. And so the treatment is kind of symptomatic treatment, but you're going to do sodium bicarb to correct metabolic acidosis. So in the event that you cannot measure metabolic acidosis, so you don't have access to labs, sodium bicarb is not like a first-line treatment. That's going to be once you kind of confirm that they're in an acidotic state. And then hemodialysis.
Yeah.
And so that's kind of the next step. So wintergreen oil can be very dangerous for kids. And then the safety tips per usual are keep them out of reach. And that's something that probably is commonly in reach.
Yeah.
In bathroom
Oil
drawers,
diffusers.
bedside drawers, diffusers, things like that. So make sure that they're not in a place where kids can have access to them.
Always recommend calling poison control, and then always really, if any child has significant ingestion and you don't need like immediate stabilization that you can't maintain, take them to a pediatric facility for sure.
Absolutely. Poison control is a fantastic resource. They will always help you out and let you know where the best place to go. We kind of talked about this a little bit on our last one because you're the plant lady. But as far as toxic plants go, plants that are probably in your house, especially closer to holiday season.
Poinsettias.
Poinsettias, yeah.
Right? So what happens? Why are kids not supposed to just be munching on these leaves?
Coming up on this holiday season, poinsettias are very popular. And if any of you have ever accidentally snapped one of the leaves on the poinsettias, you'll see like a white substance that comes out. That sap is actually pretty toxic. It can cause GI upset, so nausea, vomiting, diarrhea, abdominal pain. Also, it can have mucosal and skin irritation. So just like burning sensations or drooling, and then contact dermatitis, which is a fancy word for owie skin.
Owie skin.
And also can cause irritation in your eyes if you get it in your eyes. And then in the previous episode, we talked about a whole bunch of other toxic plants that we won't go into on this episode, but that one especially for this time of year.
All right, so some takeaways from this episode. Keep all of your things out of reach of your kids. Everything. Turns out it's all bad for them.
Yep. Utilize poison control like we talked about in our last episode.
Yep.
Absolutely.
What's that number?
1-800-222-1222.
If you need any more information on these topics, we got some of our references here. We have Nelson Textbook of Pediatrics, Goldfrank's Toxicology Emergencies, 11th edition, and also the American Academy of Pediatrics. They have lots of clinical reports on specific toxicology.
And with that, we're going to go ahead and close out this episode. If you guys would be so obliged to follow us on our social media, we have Instagram, TikTok, Facebook, YouTube, and then you can listen to our podcast on Spotify, Apple Podcasts, and also YouTube.
This has been Life in Sirens, produced by 3 nerds trying to bring you content that you might actually care about.